update in recognition of public health role to provide a safety net for persons who are vulnerable to communicable disease and cannot yet be protected. So as we now have some updates on that, I am making the following changes to our masking orders. So as we indicated on September 9th, these orders would remain in effect until community transmission for Genesee County was categorized as moderate by the CDC for at least 14 days or until further notice from the county medical health officer. So today I'm making the following factual determinations pursuant to continuation of the masking mandate. So the July 27 CDC recommendation calling for indoor masking for all teachers, staff, students, visitors to schools, regardless of vaccination status, still remains in effect. The August 13th MDHHS guidance stating that all schools should require universal indoor masking. At that time they stated it was due in part because many students had yet to be vaccinated and students under age 12 were not yet eligible. On November 2nd, the CDC granted emergency use authorization of the COVID-19 vaccine developed by Pfizer in children ages 5 to 11. And since November 9th, we've been giving out vaccines at the health department, and they are also readily available at other sources in the community. There's no shortage of vaccine available. During clinical testing, the Food and Drug Administration found the Pfizer vaccine was over 90% effective in preventing COVID-19 in children 5 to 11. The vaccine safety was studied in children with no serious side effects detected in the ongoing study. Like the adult version, it is 2 drug series. It's approximately 1/3 of the adult dose for children, and there is a 2-week wait for full efficacy after the second dose is given. So while vaccine availability was the key piece of public health response to COVID, the other mitigation measures remain critical. We want to make sure there's continued use of face masks while indoors, social distancing, frequent hand washing, avoiding touching your face with unwashed hands, frequent testing if exposed or potentially exposed, and care to ensure good ventilation in classrooms. Also, staying home even with mild symptoms until you've been tested should continue to be the norm. The ongoing recommendations by the CDC, MDHHS, and the American Academy of Pediatricians is now supported by multiple studies from the university, including from the University of Michigan, which there is a link to in the press release, that continued masking is strongly recommended until the rates go down to 50 cases per 100,000 people per week in the community. Currently in Genesee County, it is still high, with over 300 cases per week. Vaccines are not currently available for children under 5. So given those conflicting statements there, in support or not, really we're going back to the fundamental issue that vaccine availability takes it to the parental autonomy of decisions for their children. So we will continue to say that while we've strongly recommended, as we did in the directive earlier on in August, it is now going to be lifted as of December 22nd. Classrooms and other settings, activities in an educational setting that consists entirely of people 5 and up, the mask mandate will be removed, but we strongly recommend that school districts continue to require universal masking for their students, staff, teachers, and visitors. In classrooms and other activities in which include a child below the age of 5, the mask mandate will continue as written, same guidelines as we've had, until 6 weeks after the vaccine is available for those age children as well, or until the community transmission is moderate. And we again note that there is still the CDC order from January 29th of this year that masks must be worn by everyone in a school bus, and that still continues to be in effect. This order does not change that, and nor does this order repeal any other orders that are in existence through MDHHS. That's my update.